I, as a breast cancer survivor, will tell you how to cope with lymphedema from a survivor's point of view. Next slide, please. Knowledge is power. So the moment I was diagnosed with breast cancer, I attended a lymphedema workshop. I went all the way, my chemotherapy was going on and I had lost all my hair, but still it was a high priority thing for me that I needed to attend a workshop to know how things are. I being in the health sector, I knew that as the surgery for my case was stage 4, so I will lose lots of my lymph nodes and lymphedema is going to be a very important issue for me. Over and above that, I being a dental surgeon wanted to get back to work after treatment for as long as I can. And for that reason, health of my right hand was equally important. And up there I met a lot of, in that workshop I met a lot of people of the support group who were way ahead in me in their journey through cancer. And I realized that they know so many small little nuances which the doctors and physiotherapists may not let us know. Next slide, please. So the goal of any treatment for lymphedema is immediate treatment is to release swelling, but the ultimate goal of any lymphedema therapy should be to make the patient self-manage and control the chronic condition. Because if there is a massive surgery, like it was in my case, lymphedema is a lifelong threat, and you have to constantly manage it. Next slide, please. Consequences. So what happens post surgery, in even if it is a initial stages of lymph package, there is functional deficits, there is loss of mobility, there is difficulty in wearing normal clothing, and there are psychological issues. These things may be little or they may be more depending on how massive your surgery is, but they are there. The little bit of difference in all these things does happen post surgery. Next slide, please. Patient education. So while patient undergoes surgery, there is very important, like my esteemed speaker before me have put stress on, that it is very important that patient education should be at the top bracket, and the patient should be made aware of diagnosing the self-diagnosis of things which are not to be ignored, and also taught about home exercises, self-massage, skin care, precautions, and compression bandage in the initial stage itself. If you start wearing, then the lymphedema may not become too huge. So all this education needs to be imparted to the patient to empower the patient by the surgeon, and if they are not having that much time to do that kind of counseling, by a counselor or by the physiotherapist, anybody, but it should be done. Next slide, please. Sequelae. So if you have these lymphedema, which is long-standing, you will have chronic swelling, excessive tissue proteins will be there, fibrotic changes will happen, chronic inflammation, infection, cellulitis is a very high precedence of that, and pudy orange. You know, I felt that I, being in the health sector, I knew what is pudy orange. I knew that there was changes happening in my hand and things like that, but not many people know. So the rest of the things, probably these are more of a diagnostic signs, not symptoms. But pudy skin changes can be something which you can teach to the patient, that please be aware, and if it happens, do report back. Next slide, please. Signs of lymphedema. There is puffiness, heaviness, fullness in the limb, stiffness, and weakness and fatigue, skin tension, numbness, paresthesis. These are the colloquial and general language words which you can tell the patient को कि भाई तुम्हें heaviness लगेगी हाथ में तो तुम इसको lightly मत लेना, अगर तुम्हारे हाथ में fatigue लग रहा है तो तुम इसे lightly नहीं लेना. You know, because I have seen कि earlier क्या होता था कि if I overwork किसी दिन तो थोड़ा fatigue होता था, I would have a rest and next day I would be normal. But now I know that I cannot push my boundaries where my right hand is concerned. The moment I feel कि it is having fatigue, I leave that thing totally and start exercising to move my fluids. Next slide, please. So, like earlier I mentioned, that there can be an active intervention and then the self management phase. In the post surgical phase, immediately post surgery, that initial phase when the patient is actually hospitalized, that time the physiotherapist comes and gives a visit and the breathing exercises are done. And that is the time you get into the hands of a physiotherapist who start guiding you for the future. And all these things, and then post surgery till maybe a month and all things like that is, I think, the active phase. And post afterwards, when the patient is not going regularly to the doctor or regularly to the hospital, that is the phase when by then the patient should be empowered to self manage. He should be transitioned into compression banding, maintaining home program and occasional follow up appointments. If this is the way things go on, any patient will be empowered to deal with lymphedema on their own. Next slide, please. Uh, our physiotherapist from Rajiv Gandhi had talked about complete decongestive therapy. I don't think I need to tell much about it, but I definitely feel that all these things should be introduced to the patient, and depending on the skill and the interest of the patient as to how much they can handle. Next slide. So this was manual lymphatic drainage. I know how to do it, and it's only when I am too tired and or if my problem is extreme, only then I go for all this therapy. Rather, I would say that my treatment was done in 2016. Now it is 2020. In this phase, I have had one acute phase when I had to go to the physiotherapist regularly, almost for a month. Otherwise, all manual lymphatic drainage I usually do myself, especially while having my bath. Next slide, please. Next slide, please. Excuse me, can I have my next slide, please? Basic principles. So basic principle is that the passage should be clear from near the heart and then towards this extremities. Usually what happens is if a person is not knowing it and they are having somebody to massage their hand, they will always start from the extremity, from the fingertips. So this has to be told specifically. They have to be very clear about letting them know that the strokes have to be light, they have to be rhythmic, and they have first you have to clear the chamber from the heart, shoulder aside, and only then go down to the fingertips. Next slide, please. Next slide, please. Compression bandaging. Like our physiotherapist was mentioning about compression bandaging, these are very small bandages which are wrapped from fingers, each finger being wrapped separately, and then palm, and then going ahead and up. There is a huge kit which comes, medical compression bandaging kit, and it is a little difficult a task to handle on your own. But in spite of that, we have had in a support group workshops to do self bandaging on your own, so that the patient is empowered and they can do their self bandaging on their own. Next slide, please. Next slide, please. I cannot see. Excuse me. Can you share my screen?
Hello, it's shared, ma'am. You can see.
It's not visible on my screen. Doesn't matter. I'll speak otherwise. So therapeutic exercises. The next slide was therapeutic exercises. I hope that is the one which is visible on the screen. I can see Dr. J D Patel, cannot see my slides. So exercises facilitate muscle pumping. So this is also another important thing that one has to be told. The patient has to be told that exercise are paramount. And in case you are wearing a compression sleeves, the exercises should be done along with your while wearing your compression sleeve. And like I said earlier, the moment I feel that my hand is fatigued, I immediately start with my exercising regimen. So this is not something which you can ignore. The patient has to be told that immediately, the moment you have sense signs of fatigue in your hand, you should start exercising. Next is compression garments. So compression garments, fantastic compression garments are available nowadays, and they are washable, and they are having ones in which the fingers are free. Garnet, they call it garnet. There's a garnet, and the thumb and the fingers are a little free, so that with the sleeve you can actually do quite a lot of work. But in my case, I being a dental surgeon, wearing a compression sleeve all the time is not so easy for me. So I use it intermittently. As and when I have problems, I start wearing it. And when I feel that the things are a little more controlled, I don't wear it. So again and again, I say that empowerment of the patient is a very important thing, because when you empower the patient, they can make their own judgment and they can do the juggling on their own. So the next slide is new normal. So what happened after my surgery and after my treatment was that I had to get used to a new normal, in the sense that I was a very hardworking person earlier, but I had to set priorities, that my hand is capable of doing this much, and this much I should, where I should concentrate. So for me, dentistry being important, so I would like to delegate things which I can to somebody else. Now it is visible. Medical compression bandaging is visible to me. Can you go ahead? I'm at the new normal slide, which is quite afterwards. Next, 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 next. See, this is the one I was talking about, that I set my priorities, that I wanted to continue my dentistry, but still not exert too much on my hand. So I shifted into a consultant type of practice. Now I have a few consultants coming into my work, so to support me in my work, and I don't exhaust my hand. So now another new normal was that physiotherapist is the closest friend. They should be very friends with them. You should have their number on your phone book, and because time is a very important factor, like Dr. Navneet said, that how practical is it that every day you are going to the physiotherapist. So what happens is, if you're friends with physiotherapists, you can, the physiotherapist will squeeze you in the little portion of time which is available to you. Exercise to strengthen. So all the time, everybody gives you importance on strengthening your arm, which is affected. But I, for one, felt that it is important to exercise the other arm also. Because now what has happened is that when I am cooking, I would lift the heavy pressure cooker or something like that with the left hand. Earlier, my right hand was far more stronger than left hand. But now they are almost at par. I can do lots of high strength work with my left hand. So I feel that exercises to strengthen both the arms are important. Slow down. So, what happens is all this treatment and all that has a huge toll on your body, but your mind is still the same active and strong like it was earlier. So you want to do everything at the speed at which you were doing it earlier. But with this new situation, your body cannot do it at that high speed. You lose balance, you may fall, and sometimes your mobile typing is wrong because you are trying to type very fast. So you have to learn to slow down, listen to your body signals. And obviously, like it was said earlier, that any fall is very difficult to handle, especially if you injure the affected arm. Next slide, please. Discipline and lifestyle changes. So, once you have got into this cancer bandwagon and you've had the surgery, so you have to have the discipline and lifestyle changes. Earlier, as a woman, I was, doing so many multitasking. I was looking after home and a clinic and children and cooking. And many times my own self-care used to take backstage. But now I have to be disciplined. I have to make lifestyle changes that my hand and my health and my exercises are very important. So limb hygiene, which already you have, both the speakers before me have given high importance to lymph hygiene. Elevation. So wherever I go, if I am at home, my bedside is having that elevation all the time. I have a very light another pillow, that if I'm sleeping on the side, I can put it, pack it in between my shoulder. If I'm sleeping on the side, that pillow has to be light. If it is heavy, then it's not a comfortable sleep. So all that I have arranged at home. But when I go out, and if I'm touring, I'm on a holiday or something like that, the moment I reach, I start seeing, okay, रात को सोते time मैंने अपना हाथ कैसे उठा के रख के सोना है. Self massage, obviously, it was mentioned earlier. It is very important, and I do it every day. I make it a point to do it in my shower every single day. Compression sleeve, like I mentioned, I wear it off and on. The day it is light on my clinical work, that day I wear my sleeve in spite of not having any problem. And the day I have heavy clinical work in my clinic, I do not wear. And the second criteria is if my hand is fatigued, if it is having swelling, then compression sleeve is something which I definitely wear. Now I have two of them because I want to wash one and then wear the other one. And if the one is not dry, so earlier on I had one and that used to be an issue. Then I got two of them so that one can be washed and another one can be bandaging. Once I had acute problem, and that time I was going through a little of partial bandaging, which was undertaken by the physiotherapist. She used to bandage me, my hand, and then my torso, part of my torso. And I used to go next day, and that day she used to open it. I haven't done bandaging of my on my own. Frankly, I think till now I have been able to manage my lymphedema without bandaging, but we have had support group workshops in which bandaging has been taught, and I think I will be able to handle bandaging as and when it is required. Pneumatic compression pump. I have a portable pneumatic compression pump because time is a very precious commodity. Running all the time for physiotherapy, it becomes a difficult task. It is a portable one, like it was mentioned. I think it is just having 6 chambers, but I use it occasionally, not usually, but occasionally. Next slide, please. Some tweaks in my life, like I mentioned, slowing down. I have already mentioned I have had 2 falls in these 2-3 years, and they were both massive falls. And I have tried to uh, 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 try to make my brain understand that I need to slow down. My brain commands are coming too fast and my body is not able to handle them. Sleep elevation, that is a dictum I follow all the time. Car customization, because my right hand is done. So when I'm taking a car, turning my car to the right side, it is easy. But when I try to turn my car to the left side, I find it difficult. So I have tweaked my driving style. I moved the steering with the left hand at that time, supporting my right hand is just kind of supporting and my right hand is doing. Handbag, I have stopped using any handbag which is hanging on my arm. I always use a shoulder bag now. Attire, I try to cover up my hands, arms, because otherwise the minuscule difference is visible to all, especially those who are astute. They will be able to notice that about an inch of difference in my hand, arms is there. Sharp knife and chopping board. See, what happens is that if you are trying to struggle to cut in the kitchen, I am a woman, we have to do these things, you know. A woman is incomplete if she's not cooking for her loved ones. So go for a sharpest possible knife, which will reduce the force on your arm, and then cutting on the chopping board so that you don't end up injuring your finger. Obviously, I was doing this earlier also, but what I did was I went out and bought the best possible ceramic knife so that at least chopping force is lesser. Flight frequency. So although your statistics are saying that flight frequency doesn't matter, but as per my experience, I found that flights are one of the most difficult things to take because they kind of precipitate lymphedema. I am an avid traveler. I love to travel. And it was once that I took a frequent flight. I went the same day I had a presentation. I gave that presentation, and the same day I came back to Delhi. That was the time when my lymphedema, like I had acute mm, stage of pain in my chest and arm. I went for physiotherapy, regular physiotherapy for around a month and things like that. So although I was using my compression sleeve in the flight while going also and while coming also, but I felt that it was the frequent flights which precipitated it. Other than that, I've had 2 occasions having long flights. Once I went to Africa, so it was a long flight from here to London and then to Africa. And after that, for about a day, my arm was swollen and quite painful. Same happened another time when I traveled to USA. So I find as a survivor's experience, I find that flights can be one of the most dangerous aspects for precipitating lymphedema. And mobile typing, that like I was mentioning, that it is always a little difficult to go on the left side at a very high speed when I am, because it's my right hand is affected. So when I'm typing on the left hand corner side typing, I many times skip an alphabet. Next slide, please. So what happens in lymphedema is that you have to have a multi-pronged approach. Do all the good you can by all the means you can, in all the ways you can, in all the places you can, at all the times you can. And these kind of workshops and our support groups, it is to spread the knowledge to all the people you can for as long you ever as you can. This is this is something Joel Weasley has said. I loved it, and I'm sharing it here with you. Next slide, please. Thank you. I am Dr. Seema Goyal. My email is here in case anybody wants to get in touch with me for any support group activity or awareness workshop. I would love to work pro bono for such aspects. And I am thankful for the opportunity given here to empower the public. Thank you.
I think it